Action. So this is my identification. I'm Susan Powell. This is my rubric that I'm using. I'm showing it to you. Alright. Back. I'll lay it right over here. Alright, and we'll begin. Okay. Hi Brandon, how are you doing?
I'm good, how are you?
I'm doing alright, thank you. My name is Susan. I am the nurse practitioner that will be doing your full head to toe assessment today. We'll be looking at your eyes, your ears, feeling around on you, doing some sensory motor tests. Is that okay with you?
Mm-hmm.
All right. And we've already did some vitals. Your blood pressure in your right arm sitting was 120 over 60. Your radial pulse was 60 beats per minute. Your respirations were 12 a minute. Your oral temperature was 98.4 Fahrenheit. Your oxygen saturations were 100% on room air. Now I'm going to ask you some orientation questions for you. Can you tell me your first and last name?
Brandon William.
All right, and what is your date of birth?
9/10/1985.
And what is today's date?
It's December 2nd, 2020.
All right, and who's the President of the United States?
Donald Trump.
And tell me your phone number.
It is 812-225-2941.
And I'm going to give you 3 words I want you to remember, okay?
All right.
Black, gold, June.
Okay.
All right, repeat those back to me.
Black, gold, June.
All right. So Brandon appears to be in good health, good hygiene, good posture. Looking at his face, there's no involuntary motor movements. Face is symmetric, eyes, nose, lips are pink. And it seems appropriate. So Brandon, tell those 3 words again to me back.
Black, gold, June.
All right, and are you right or left-handed?
Right-handed. All
right, I'm going to look at your skin. I'm going to feel on your skin. All right, and there are no masses or lesions noted. You're warm. I see several areas of nevi noted. Have you had those checked out, Brandon?
I have not.
All right, I would advise following up with your doctor in your next appointment. May need to see a dermatologist for that, okay?
Okay.
So, good muscle tone equal bilaterally. Look at your skin and your fingers and nails look good. It's pink, no cyanosis. Cap refills less than 1 second. Fill in skin turgor, it's less than 1 second. It's very good bilaterally. I'm going to feel your pulses, your radial pulses. Radial pulses are 2+ bilaterally. Kind of move around on your wrist here. Any pain?
Nope.
So no pain noted bilaterally. Any pain here?
Nope.
Any pain here?
Nope.
All right. So no pain noted in the upper extremities bilaterally. I'm going to look at your face and head. All right. So you have, it looks like good full head of hair, evenly distributed. No nits, no lumps, no bumps. Any pain with that?
No.
And you've got your beard here. You got a great beard. No nits, no lesions noted. I'm looking inside. All right, I want you to bite up and down, side to side. All right, and no pain noted with the TMJs bilaterally. I'm looking at your ears. Any pain with the pulling on it?
Mm-hmm.
No pain with pulling on the ears bilaterally. No lesions to the ears. No rashes, no masses. All right, now I'm going to feel your lymph nodes. All right. Any pain?
No.
This is the pre-auricular, and let me know if you have any pain or tenderness. So
okay.
Non-palpable bilaterally. Post-auricular, non-palpable bilaterally. My hands are cold, I'm sorry.
Oh, you're fine.
Tonsillar nodes are non-palpable. All are non-palpable bilaterally so far. Submandibular is non-palpable bilaterally. Submental, non-palpable bilaterally. Occipital, non-palpable bilaterally. Anterior, superior, posterior, cervical, all non-palpable bilaterally. I'm going to turn here. Deep cervical, non-palpable bilaterally. Deep cervical, non-palpable bilaterally. And then superior, clavicular, infraventricular nodes are non-palpable bilaterally. All right, and take a look at your neck and back. Your trach is midline. All right, feeling the thyroid. It is soft. Does any tenderness noted?
No.
No tenderness noted. And take the swallow for me. Okay, cranial nerve 9 is intact. The thyroid rises midline and is equal bilaterally. Okay. So now, Brandon, I'm going to go ahead and look at your eyes, check your vision out. Do you wear glasses?
No.
Let me look at your eyes first. There's no strabismus noted. It's clear or white. Look up for me. Conjunctiva or pink. There's no lesions, no drainage noted. So what I'm going to do is, you wear no glasses. This chart, I want you to read from the bottom up. Close one eye.
L T F P H.
All right, and do the other eye and read it backwards.
H P F T L.
All right, good. So vision is 20/20, intact bilaterally, and then we're checking your cranial nerve 2. That is your optic nerve. So what I have you do is I'm going to look, trying to light in your eyes. So look straight ahead there, Brandon. All right. Okay, there's no opacities, no crescenteric shadows. Corneal light reflection is symmetrical bilaterally. Okay, keep looking ahead. Okay, pupils are 2 equal reactive to light, consensual and direct. Now I'm going to have you look straight ahead. Look at the pen light, straight ahead. Okay, accommodation intact bilaterally. Now I'm going to have you look at this pen light. I want you to follow it. Don't move your head, just follow it. Okay. Okay. Any double vision, any problems? So cranial nerves 2, 4, and 6 are intact, no nystagmus. I'm going to do your peripheral exam. I'm going to put my hands behind your back, and you tell me when you can see my hands, okay?
Okay. I can see them.
All right.
Both are wiggling.
All right. And look straight at me. Let me see.
I can see them. Both are wiggling.
All right, one more time.
I see them. Both. I'm sorry.
Okay. That was not the So peripheral vision intact times 4 quadrants bilaterally. All right. Now, Brandon, I'm going to shine light in your eyes. It's a little uncomfortable. I apologize. But,
it's okay.
All right. So just look ahead there. I'm coming in. My tippy toe. Sorry. All right. Just look ahead. Okay. Red reflex noted. Sorry. I'm close and personal. All right.
Yes, huh?
Look again. I'm short. I apologize. So red reflex noted. All right. So optic disc and cup are visualized. The borders are clear. There's no hemorrhages, no exudae, no papilledema, no AD nicking noted. So both bilaterally. Cranial nerve 2 is intact. All right. Now, Brandon, I'm going to check your ears out, okay? Do you have any problems with your hearing?
I had tubes when I was younger.
And you've had no problems since?
No.
You have seasonal allergies?
I do.
Okay. Oh, my goodness. Okay, so we'll start off. We'll do a little hearing test. We'll test the cranial nerve 8. So what you do is plug off one ear.
Okay.
I'm going to whisper some words in this ear, and you repeat them back to me.
Cat, dog, teacher.
Same thing over here.
Blue, red, purple.
All right, auditory, intact, bilaterally. All right, now I'm going to strike this tuning fork. I'm going to put it right behind your ear, and
Okay.
you're going to let me know when you can hear it and when you can no longer hear it. Okay? You ready?
Yep. I can hear it.
And tell me when you no longer hear it.
No longer hear it.
You still hear it?
I can.
All right. This is called the Brand test.
I can hear it.
Tell me when you no longer hear it.
No longer hear it.
Still hear it?
Uh-huh.
Can you do it on your forehead here? This is the Weber test. Tell me where you hear it at. Left or right, or it's in the middle.
Looks like it's in the middle.
All right, good. So all intact. So cranial nerve 8 is intact. Now I'm going to take a look inside your ear. we've already looked outside. We did the tug test, and all of that was good. So I'm gonna take a look up and out here. See a little bit of earwax. Okay, all right, I come over here. And again, same thing, up and out. We didn't have any pain, and the skin looks good. A little earwax. So both ears, I viewed the tympanic membrane. It is pearly gray, no erythema, no drainage. See the cone light, which is good, equal laterally. All right, so we checked your hearing, we checked your eyes. Now we're going to check, while we're on your face, we're going to check your cranial nerve 5.
Okay.
So what I'm going to have you do, I want you to feel this. Is that sharp? Do you distinguish that it's sharp and that is dull?
Uh-huh.
I'm going to have you close your eyes. I want you to tell me what you feel as I go along. So here we go. Is it sharp or dull?
Sharp. Dull. Sharp. Dull.
Okay.
Sharp.
All right. I'm going to take a little cotton. I want you to feel it again. Can you feel it?
Uh-huh.
All right. And it all feels the same. All right. So I want you to write down. Okay. Write down. So cranial nerve 5, sensory, and motor are intact. I felt the masseter muscles and temporal muscles are very strong and equal bilaterally. All right. Now I'm going to have you shrug your shoulders, push down, push up against my hand with your face. Okay, cranial nerve 11 is intact. Now, Brandon, I'm going to go ahead and look inside your mouth. All right.
Okay.
So, any problems with your mouth at all? Nothing like that? Okay. So what we'll do, I want you to open your mouth. You stick out your tongue. Yes. Oh, wrong way. Got the light in the wrong direction. I do not see tonsils. You've had your tonsils taken out.
Uh-huh.
All right. Say ah. All right. Cough. Look around inside. You had some work done, haven't you? So missing teeth there. Sorry, I'm making you talk. See, no dental caries, but you've had fillings. Look under your tongue here. Mucosa all looks pink. There's no lesions. Cranial nerves 9 and 10 are intact. Now I want you to stick out your tongue. Move it side to side. All right, looks good. It's midline, bilateral. That is your cranial nerve 12. Okay. All right. Now, I think we did all of that. So I'm going to have you turn around, Brandon, if you don't mind. We're going to listen to your lungs, check your back. All right. Let me get some pillow there.
Oh,
all right. That's all right. So viewing on inspection of Brandon's back, several areas of nevi. Again, we discussed that. You have to have that checked with your next doctor's appointment, okay?
Okay.
I'm going to feel around. There's no masses, no lesions otherwise. I'm going to feel around. You tell me if you're having any pain, okay?
Okay.
We're right about the C7, T1 area. Going down. Tell me again if you have any pain.
Not yet.
All right, not yet. Anticipate it. Coming down on the thoracic. Okay. Any pain?
No.
Right about here, we're at the T12 level. Any pain?
No.
Tenderness? No pain at all.
Right there.
Right in here.
Yeah.
All right, so about lumbar 1, 2 maybe. There's some reported pain and tenderness. Any pain?
Right through there, yeah.
Right in there. It's on down. So the lumbar 1 through 5 area is you have some pain. So take a deep breath, Brandon. All right, and breathe out. So inspiratory respiration is equal, symmetrical, bilateral. All right. Now, Brandon, I'm going to feel along your back, and as I do, you say 99. Okay, you ready?
Okay. 99. 99. 99. 99. 99. 99.
All right. Tactile firmness is felt throughout bilaterally. I'm going to go ahead and go to percussion. Here. Kind of give yourself a hug there. There you go. Listen. Good. Okay, so Resonant lung sounds percuss throughout bilaterally. Now, Brandon, I'm going to listen with my stethoscope.
Okay.
And as I touch your back, you say the letter E. Okay? With my stethoscope. Go ahead.
E, 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 E.
So the letter E was heard throughout all lung fields bilaterally. And I do not see any extra accessory muscles being used. There's no labor breathing. Okay? Just breathe normal throughout your mouth. Okay? Here. It's good. So no vesicular breath sounds heard throughout bilaterally. No adventitious breath sounds heard throughout bilaterally. Okay, Brandon, I'm going to go ahead and have you lay down for me. Do the same thing on the front, okay? And just make yourself comfortable. I know it's not a very good exam. So, looking here, and say 99 for me again.
99, 99, 99, 99, 99, 99.
All right, tactile primitive felt throughout all lung fields or bilaterally. And I'm going to tap on you again, just like I did before. There we go. Okay. Okay. Resident lung sounds heard bilaterally throughout all lung fields. Okay, now same thing again. Say the letter E as I touch on your chest.
E, 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 E,
E. All right. Good. E sound heard throughout all lung fields bilaterally. And just listen again like we did before. Just read normal. All right. Vesicular lung sounds heard throughout all lung fields bilaterally. No adventitious lung sounds heard bilaterally. Now I'm going to take a look at your neck here. Look towards your left. I'm looking for your jugular vein. I don't see any JVD noted here. I'm going to take a look on the other side. Turn to the other side, Brandon. All right. No JVD noted bilaterally. All right, now I'm going to listen. Feel your carotid pulse. There you go. Do one at a time. We cannot do both at the same time. Okay, I'm going to take a listen. Listen with the bow. Take a deep breath, Brandon, and hold it. Okay, I'll listen. There, sorry. All right, you can breathe. It's fine. So, no thrills felt, no bruise heard. Carotid pulse was felt. Not bounding though, brisk. Now I'm going to take a look here at the sternal notch, the angle of Lewis. I'm going to try to see if we can feel your PMI, your point maximal impulse. So it's about the second intercostal space. Okay. Now I do not see any heaves, lifts, thrills noted. Okay, so PMI is located about the 6th intercostal space. No thrills. It's about a quarter in size. All right, now Brandon, I'm going to take a listen at your heart. Listen in the aortic. Okay, pulmonic. Tricuspid, mitral. I'm going to listen with the bell of my stethoscope. Okay. So S1, S2, no sound of S3, S4, no murmurs heard, no splittings upon auscultation of your heart. So now, Brendan, I'm going to look at your belly. So looking at your belly, I see that you've had a scar here. Did you have surgery?
Thyroid stenosis.
As a baby?
Uh-huh.
And you've had no problems since?
Mm-hmm.
All right, so umbilical is central. I'm looking, I don't see any masses, lesions, some striae noted here, no hernias noted. I'm going to take a listen at your belly. Listen with the bell. Okay. So active valve sounds heard in all 4 quadrants. Did not hear any bruise. Friction rub, venous hums in the aortic, femoral, and renal arteries. Now I want you to bend your knees, put them on the table if you can, okay? Yeah. I'm going to feel around and you let me know if you're having any pain or tenderness. All right. Go ahead and listen here too while we did that. Tympany heard through all 4 quadrants. Let me start. I'm going to see if we can find your liver here.
Okay.
Okay, kind of put your finger right there. All right, so liver percussed and it's about 5 centimeters diameter, midclavicular line. All right, you can put your hand down. Let's see if we can find the spleen. Take a deep breath. All right, a negative for any percussion of spleen. All right, now I'm going to deeply palpate, okay? Sorry, if it hurts you, please let me know, okay?
Okay.
Any pain?
Nope.
So no pain on light or deep palpation. I'm going to find your liver border. So take a deep breath. I'm sorry I'm hurting you.
No, you're fine.
And breathe out. Breathe in. Breathe out. All right. Liver border felt. No nodules felt or palpated. Take a deep breath. All right. Good. I do not feel the spleen. The spleen is not palpable. Now this is a little more uncomfortable, so take a deep breath. Okay. All right. I'm going to come over here. The same thing. Brandon, I want you to take a deep breath. All right. So kidneys, I could not palpate. Okay. Feel your inguinal lymph nodes. They are non-palpable. Pulses here are your femoral pulses are equal bilaterally 2+. All right, now Brennan, I'm gonna look at your legs. We can cover your rest of your body up. I know it gets cold. I'm sorry.
It's fine.
All right. So inspecting the lower extremities. I see no masses, no lesions, no edema, no erythema. I'm gonna feel around your hips. You let me know if this hurts.
All right.
All right. Any pain?
Nope.
Pain in the knees, in the ankles, the toes. Range of motion of the toes are good. All right. Okay, so I don't need to check these, but I'll check your posterior tibial pulses. They are 2+ equal bilaterally. Dorsalis pedis pulses equal bilaterally. Cap refill is less than 1 second. Okay, the big toes, I can position them about 45 degrees laterally. All right, I'm gonna rub your feet again, okay?
Okay.
All right. The Babinski is negative bilaterally. Okay, and there's no pretibial edema noted to the bilateral extremities, lower extremities bilaterally. So I'm gonna have you do some active range of motion, Brendan.
Okay.
Bring your knees to your chest. Put them down, spread them out, put them together, crisscross, both ways. Put your feet up and down. And we're going to do this again, but I want you to resist me, okay? Bring your feet up, or your knees up to your chest. Maybe stop. Resist, resist. Might kind of put your feet right here. Okay, resist, resist. All right, now put your feet back down. All right, and push like a gas pedal up against me. Pull back. Good. All right. So resistant passive range of motion to bilateral lower extremities, 5 out of 5. Active range of motion is within normal. Brandon, you can go ahead and sit up for me. Thank you. Keep yourself covered. Right? I know it's cold. I'm going to check your range of motion in your neck.
Okay.
So what I'll have you do is side to side. All right, up and down. Ear to the... Okay, good. So a cervical range of motion is within normal limits. And now, Brennan, I'm going to have you put your arms together like this. All right. I want you to pull against. Okay. All right. Now, I'm going to have you do some range of motion exercise, and we'll get back to that. All right. So up, out. See if you can go over like that. That. Crisscross. Okay. I want you to squeeze my fingers. Okay, don't let me let go. All right, good. And push up against you. Back. Spread your hands like that. All right, good. And do that. All right. So resistant range of motion, 5 out of 5 to both upper extremities. And your tone looks good. You're very strong, that's for sure. All right. Now I'm gonna do a series of more tests here. I want you to look at my finger and touch your nose and touch my finger. Keep doing it real fast. Okay. Move it. All right, and do the other one.
Other finger?
Yeah. The other. Yeah. Sorry. Yeah. Okay. So point to point is intact bilaterally. Okay. So now I'm going to check your reflexes, Brandon. So here on this right arm, just kind of relax. Very good. All right. Put your arm, kind of sway it like that. All right. Okay. Over here, let's get rid of that. Okay, do the color. And so reflexes are +2 upper lower extremities bilaterally. All right, now Brandon, I want you to do this, and tap my hand with your foot. Do the other one, do both. So rapid alternating movements are equal bilaterally intact. Okay. Now, Brandon, I'm going to do a vibration test where I hit this, and you tell me when you feel it and when you don't feel it anymore. So close your eyes and put your hands out. And just kind of put them on your lap. That's fine. All right, ready? You feel it?
Feel it.
When does it stop?
Stop.
All right. Same thing.
Feel it. Stop.
All right.
Feel it. Stop. Feel it. Stop.
All right. So vibration intact. Upper and lowers bilaterally. Okay. So now what we're going to do is we're going to do pain and touch sensation, sort of like what we did with your face. But this time we're going to do it in your extremities and your back. And you tell me if you feel dull or if you feel sharp. Okay. So close your eyes. Kind of put your hands out. There you go.
Sharp, sharp, sharp. Dull, dull, dull. Sharp, sharp.
Okay.
Sharp, sharp, dull, dull, sharp, sharp, sharp.
All right. So pain and light touch is intact to all dermatomes tested bilaterally. Now we did the vibration. Let's see what else we can do here. I want you to do your heel to shin on both sides. Heel to shin. So, all right, do it with your eyes closed.
Oh, sorry.
No, you can do it both. It's both, yeah. All right, you can stop. And heel to shin is intact. Now, Brennan, have you stand up for me.
Okay.
You just stand there. I won't let you fall.
All right.
Close your eyes. All right. You can open your eyes. That's fine. So negative for Romberg. Now I'm gonna have you stand there and do this and close your eyes. All right. I'm kind of pulling you. All right, good. So no pronator drift noted bilaterally. Now, Brandon, I'm going to get you to your hips. I want you to go forward, side to side. Okay, turn. All right, that's good. I want you, and so thoracic or lumbar has good range of motion. Now I'm going to have you walk heel on your heels, going that way.
Okay.
All right, good. And come back on your toes. Can you walk on your toes?
Uh-huh.
All right, and then I want you to walk toe to heel in front of you, like that. And then on the way back, I want you to walk regular. So good coordination, gait is steady. All right, I'm gonna have you sit down. Okay. So what I'm gonna have you do, Brandon, is I want you to count back from 100 by sevens.
Okay.
Okay, go ahead.
100, 93, 86, 79, 72.
All right, that's good, good. Now I'm gonna have you, I want you to draw face of a clock, okay?
All right.
That pen works. I'll have to do discrimination as well. All right, good. Now I'm going to have you draw the time of 10 to 11. 10 to 11. Alrighty, very good. All right, did it just accurately. Now I'm doing a discrimination test. So I'm going to give you two familiar objects. You close your eyes, and I want you to tell me what those objects are. Okay. So close your eyes, hold your hands out. Okay, what is that?
Coin.
All right, and what is that?
A pen.
All right, now I'm going to draw two number in each palm of your hand. You tell me what it is.
1.
All right.
6.
All right, good. So discrimination is intact. Diagnosis and graphesthesia is intact. I need to check your olfactory nerve,
Okay.
cranial nerve 1. So I'm going to give you two familiar smells. I want you to close your eyes, hold off on one of your nerves there. There you go. Tell me what you smell.
Mint.
Yes, and do the other side.
Coffee.
Yes. So olfactory nerve 1 is intact. I believe that's it, Brandon. I'm going to look over my rubric. I think I haven't looked at it one time. Do you have any questions for me
No.
so far? So what we need to discuss is your follow-up appointment with the moles that you have.
Uh-huh.
All right, it's very important. And you did have some tenderness to your lumbar region.
Uh-huh.
I would follow up as well with that. Make sure you use proper body mechanics at work, maybe even a back brace.
Okay.
And also, follow up with your immunization. Keep your immunizations up to date. I think we're done. And you're right-handed, you say?
Correct.
All right. Okay, I think we're done, and I appreciate your time with me. Again, Brendan, thank you so much.
Thank
I'm going to wash my hands.
All right.